Hi, I'm Ellen and welcome to Mentally Detoured. This episode is just the basics of the types of mental illnesses. Talking about each different disorder will happen, and sometimes will happen on multiple videos, simply because these disorders are complicated. Today, it's enough just to get an overview. I have been using some of the terms interchangeably, and I want to set a standard so that there isn't any confusion. When I use the word illness, I am just referring to the opposite of good health, and I will try and limit the use of that word. And when I'm talking about mental health or mental disorders, try and stick more with disorders. Now, it does get a little more complicated when you throw in the words disease and syndrome, and so I want to clarify the definitions of those and how I'm going to use them. A disease comes from some kind of biological malfunction. A disorder is an abnormal mental or physical condition. Think something out of the ordinary and don't get hung up on what the definition of normal really is. Finally, a syndrome is a collection of symptoms that often occur together and may or may not have a known cause. In the case of mental disorders, many professionals agree that they are a combination of biopsychosocial factors. The bio acknowledges that there can be a biological factor in the brain's biochemistry and/or the person's genetic makeup. This might be referred to as the nature part of the nature versus nurture argument. Then we have the psych factor, which is based on a person's personality and how they were raised, so the nurture part of the argument. The social component is our relationship with others and how we socially interact and communicate with them. When I was a psychology major way back when, if you put the word biopsychosocial in any essay question answer, you were sure to get at least some points, even if you didn't know what the complete answer was. Okay, with that out of the way, the standard classification of mental disorders is found in the Diagnostic and Statistical Manual of Mental Disorders, here on out referred to as the DSM-5. I don't want to wade too deep back into the history, except to say that the first version, DSM-1, was published in 1952. There is another classification system, the International Statistical Classification of Diseases and Related Health Problems, ICD, produced by the World Health Organization. This classifies health as a whole and not just mental disorders. For my purposes, I'm going to use the DSM-5, which is the 5th edition of the DSM. I bought this little desk reference for the DSM-5, not just because it was small and cute and fine for my needs, but also because it was significantly cheaper than the complete version, which I don't really need and is primarily used by professionals. Anyway, like any classification system, the DSM-5 has its critics, and I'll mention criticisms when I'm talking about the specifics of a disorder. Let's classify. Who doesn't love a list? Isn't that why BuzzFeed is so popular? Here are some of the categories of mental disorders listed in the DSM-5, though this is not an exhaustive list. The three biggies, thought, mood, and anxiety. There's thought disorders. This includes schizophrenia, schizoaffective disorder, and delusional disorder, and has symptoms that include disorganized thoughts, hallucinations, and psychosis, which is a loss of touch with reality, among other symptoms. Mood disorders includes bipolar disorder and depressive disorders, and these are where your moods or emotions can become disordered. That is a lot of disorder. Anxiety disorders include generalized and social anxiety disorders, phobias, and panic disorder, and these are just a few of the anxiety disorders we will learn and talk about. Obsessive-compulsive disorders used to be in the anxiety category, but it has now been expanded and includes such things as hoarding. Trauma and stressor-related disorders break PTSD out of the anxiety disorder category as well. Another main category is personality disorders, and there are 10 types of personality disorders. I'm not going to list them all today, but these include borderline personality disorder, BPD, narcissistic personality disorder, paranoid personality disorder, and avoidant personality disorder. There are more categories and disorders classified in the DSM, but I just want to mention a few more that you may have heard of that are also included. Eating disorders, gender dysphoria, antisocial personality disorder, substance use disorder, neurodevelopmental disorders such as ADHD, and neurocognitive disorders such as dementia, although they don't call it dementia anymore, and when I talk about that, I will explain that. The current DSM, as in the previous DSM editions, do reflect our culture and the time that we live in, and it seems, right or wrong, that some mental disorders may be trendier than others or may be trending more. It may be that there's just more research on a particular disorder and it's in the news more. Diagnosing a mental disorder can be one of the trickiest, most frustrating things around when you or a loved one is confronted with one. Without specific biological markers such as blood tests or MRIs, it is not uncommon for people to wait years to get a definitive diagnosis, and sometimes it doesn't even happen. If someone is experiencing mental distress and is not in a crisis, a good rule of thumb is to have a complete physical with an internist or general practitioner to rule out any physical reason for the symptoms. Until next time.